Everybody ready? Great. Good afternoon. Thank you all for being here today. It's cold outside up here compared to Southern Nevada, and it's a refreshing day. I'm glad to be back in Northern Nevada this week, and glad to be here today to talk about this very important topic that we're going to get into. Earlier this month, the Nevada Department of Health and Human Services submitted a draft of our state-specific plan, or what we call our playbook, as we refer to it, for COVID-19 vaccine planning to the CDC, Center for Disease Control. This high-level planning document, which is subject to review and final approval from the CDC, was a tremendous effort between a number of stakeholders to make sure that Nevada is prepared when a vaccine becomes available. And to make it clear that when a vaccine becomes available, we do not have a vaccine currently. The Nevada Playbook is a living document, meaning we will adapt and adjust as the overall vaccine response develops and up until a vaccine is deemed safe and effective by the Food and Drug Administrations. I know a lot of Nevadans have been following this topic with a great deal of interest. So have I. And I know that there's a lot of unknowns and a great deal of misinformation about COVID-19 and the potential vaccines against the virus are currently circulating. I want to be very clear with Nevadans. There are still many unknowns before a vaccine is finalized and ready for distribution. But I also want Nevadans to know the state has been planning for months, and the state will be ready when the time comes. We will be prepared when the time comes. It is natural for the public to have questions about a new vaccine, and the state of Nevada is committed to transparency regarding vaccine planning and expectations. That's why I'm joined today by two of our experts in the vaccine planning team that you'll be hearing from shortly. Candace McDaniel from the Health Bureau, Chief of the Bureau of Child, Family, and Community Wellness Division of Public Health and Behavioral Health is with me, as well as Shannon Bennett, Immunization Program Manager, Division of Public and Behavioral Health. What we do know is there is no approved vaccine at this time. I want to repeat that. There is no approved vaccine at this time. There's a lot of speculation, but there's no definitive timeline for when one may be approved. But we want to ensure that upon approval, Nevada has a system in place for the distribution and administration of a safe vaccine as the supply becomes available. Vaccination planning is not new to the state of Nevada. We are fortunate to have an existing framework that is managed by a team of experts who work on these efforts on a day-to-day basis, with other programs such as Vaccines for Children and the flu shot program, which we're dealing with right now. And while we're on the flu shot program, I want to encourage everyone who has not gotten a flu vaccine, please go and get one soon. We're getting in the winter months where the flu vaccine is extremely important. I know there's a lot of areas around town where you can get it, and I encourage everyone to please go get your flu vaccine. With that, I will turn it over to our team members who have been working diligently on our planning efforts. After Ms. McDaniel and Ms. Bennett speak, we'll have some time to answer questions about a COVID vaccine. Ladies.
Thank you for the introduction and opportunity to talk today about the Nevada State Immunization Program and the COVID-19 vaccine plan. My name is Candace McDaniel, and I serve as the Bureau Chief for the Child, Family, and Community Wellness in the Department of Health and Human Services. As the governor said, at this time, a COVID-19 vaccine has not yet been approved. While we do not have the vaccine to distribute, we have been focusing on the plan for how the vaccine will be allocated within our state and talking with key partners about the process. We anticipate only receiving a small number of doses to begin with, and our program has developed an outline of priority populations based on their level of exposure. This framework is based in science, using the information we now have, and it focuses on our frontline medical professionals first, with priority consideration for those who are in close and sustained contact with individuals who have COVID-19. While we cannot speak to decisions being made by federal agencies, such as the FDA or the CDC, we can ensure that we have a plan in place for Nevadans. Nevada's playbook was submitted to the CDC on the 16th, and it is our framework. It is a living document, and we will add to it and adjust as more is known. The plan is like a frame of a house, and it sets the structure, but now we need to furnish it and attend to the details. Our goal is to be as prepared as possible when the vaccine becomes available in our state. It is important to know that working with immunizing providers, distributing vaccine, and tracking doses are not new to DHHS and the immunization program. We have an established system in place and a staff who work on these activities every day. And we have reviewed the lessons we learned during the H1N1 flu pandemic in 2009. The Nevada WebIZ system has been in existence for years, and it is widely used by Nevada's immunizing providers. And Nevada state law requires that all vaccines given must be entered into this system. This system is used for our Vaccines for Children program. Vaccine requests are documented and reviewed by our staff, and providers already use this system to manage vaccine inventories. It will be used to manage and distribute COVID-19 vaccine in the same way. Shannon Bennett will now talk about the federal process of approval for the vaccine.
Thank you, Candace. My name is Shannon Bennett, and I am the Immunization Program Manager in the Division of Public and Behavioral Health. As we said, the timing for an approved COVID-19 vaccine remains unknown, but the process for approval remains the same high standard as has always been used for vaccines. The vaccine goes through several levels of clinical trials, each including more individuals who are monitored for side effects and the effectiveness of immunization. People of different ages, races, and ethnicities are included in the clinical trials, even on the accelerated timeline of COVID-19. There are currently no trials, including children or pregnant women, and we do not expect a vaccine for those groups until clinical trials are expanded to include them. In order to meet the aggressive timeline of the federal government's Operation Warp Speed, COVID-19 vaccine is being manufactured while it is still in the clinical trial phase. This is the main reason that a vaccine will be available for distribution as soon as the manufacturer can present a strong case to the FDA for emergency use licensure. However, if the vaccine is not deemed safe and effective by the FDA, then it will not be released for use. We know vaccine hesitancy is in the news a lot and people have concerns, but we can be confident that a vaccine will not be released if it has not been deemed safe and effective by the FDA and the CDC's Advisory Committee on Immunization Practices. During and following the clinical trial, the vaccine is reviewed by 3 national independent review boards. These independent groups make the final determination of if a vaccine is licensed and will develop recommendations for use in certain population groups like people with comorbidities and underlying health conditions. To develop Nevada's COVID-19 vaccine plan, we had to consider a variety of factors to be prepared for the different vaccines when they become available. Some criteria may change, but from what we know, there will be new challenges relating to storing and handling and distributing this vaccine. The COVID-19 vaccine distribution will involve challenges such as ultra-cold storage and handling requirements, 2 doses that are not interchangeable between products, plus safely vaccinating Nevadans during an ongoing pandemic. This task is monumental and will represent the greatest public health effort of our generation. We are working with our partners statewide, including providers, pharmacies, tribes, and the Statewide Immunization Coalition, to prepare for a variety of distribution scenarios when the vaccine becomes available and we have information on the amount of vaccine allocated to Nevada. Again, we want to stress that initial supplies of vaccine are expected to be limited and therefore will be prioritized for populations most at risk for exposure to COVID-19. We are committed to equitable distribution of a safe vaccine following directives based on science.
Thank you. Thank you very much. We will also be including vaccination updates as much as possible on our press calls, at task force meetings, or at my future news conferences. Additionally, the full vaccination playbook that was submitted to the CDC will be made available after this press conference. It will be made public. Finally, I also want to take this opportunity to follow up on our COVID numbers. On Saturday, this past Saturday, the state reported over 1,000 cases for the first time since July. For the first time since July, we had over 1,000 positive cases. As of today, 8 of Nevada's 17 counties have been flagged for elevated disease transmission. 11 counties have more than 200 cases per 100,000 over a 30-day period. 8 counties have a positivity percentages over 8%. 4 counties are over 10%. And while Nevada's healthcare infrastructure continues to be moderately impacted by COVID-19 hospitalizations, we know from experience that an increase in cases ultimately leads to an increase in hospitalizations, and unfortunately, oftentimes translates into an increase in deaths. There's proof of this around the country right now, including some of our fellow Western states where we're seeing hospitalizations reach dangerous record-setting levels. Potential care rationing has taken place in some of these areas. They're transporting patients in some of these areas to other states that might have capacity available for hospitalization, and they're doing everything they can to make sure that everybody gets care, but that is what we are looking at. Folks, I don't know how to make this clear. This is real. It would be irresponsible of me to say that our state, to minimize the risk that our state is currently facing. We're not rounding the curve. We as Nevadans have some tough choices to make, and we're going to make them together. Right now, I am working on a plan to increase capacity to 50% for conventions beginning January 1st of 2021 to get business back to the state and Nevadans back to work. This will help us on our job situation in terms of employing people. The business side, the people that are coming for these conventions can provide business to our local and our resort businesses, and the tax revenue that will be derived as a result of that. So it is my goal, and we're working towards increasing the capacity for conventions to 50% by January 1st of this year, next year, 2021. I'm working with the health officials and education leaders to determine how we can get all of Nevada's students back into the classroom as soon and as safe as possible in a responsible manner. We're working with all 17 school districts to get our kids back in classrooms to begin their learning experiences again. These are just some of the goals we're working on. But whether or not we get there is not a matter of luck, it's not a matter of chance, it's not a matter of we'll see what happens, it's a matter of each and every one of you. We need the public's help and cooperation to make this possible. And I speak to people every day. My wife speaks to people every day, my kids do. If you want to be able to go see your grandson playing their 5th grade basketball game, if you want to go see your granddaughter in a play or graduate from 8th grade or whatever it might be, or get an academic award or an athletic achievement, if you want to be able to go see an athletic event, if you want to be able to go to a professional event, a Vegas Golden Knights game or a Raiders game someday, it's all up to you. You are the deciding factor of whether or not we can make this happen. And I'm going to ask for your help. Again, I'm going to ask for your help. You have to make a choice today, to make a choice this week and in the months ahead of us. Do you care more about your child returning to in-person learning than you do to attending that Halloween costume party? Do you care more about returning to your job than having a gathering at your home with no social distancing or no masking? Because those are the choices we have to make. Those are your choices. Those are our choices. I choose our students. I choose our jobs. But I need all of Nevadans to make those choices with me, to make those our priorities. So I'm going to say the following on repeat, and it's not the first time that I've said it. And I know that some of you get tired of hearing it. I know you're dealing with COVID fatigue. So am I. But this is a time we have to double down. We have to do more. So this is what I'm asking of you. We need to wear face coverings. It is not a political statement to wear a face covering. It protects others. It protects your loved ones. It protects your family. Other people wear a mask to protect you. I'm asking you to wear a mask to protect them. I'm asking you to practice social distancing. 6 feet. Stay 6 feet apart. Wash your hands. Use hand sanitizer. Avoid crowds. Avoid large public gatherings, private and public gatherings. If you're sick, if you're not feeling good, if you think you might have been exposed, if you're feeling under the weather, stay home. Please stay home. Do not take the potential impact of infecting someone else because you're not feeling good. Too many people say, I just thought I was feeling under the weather, I thought it was a cold. Maybe it's not a cold. If you're not feeling good, please stay home. Get a test if you have had a positive contact or you are feeling any symptoms. Get a test. Tests are available readily. The turnaround time is quick, and it'll help all of us, especially this flu season. More important than ever right now, get your flu shot. If you haven't gotten it in the past, I went, my wife and I went. It's painless. It's easy, it's convenient, and it can help save our hospitals. It will prevent burden from coming down on our hospitals where people don't know if they've got COVID, they've got the flu, and we got our emergency rooms overwhelmed with people with flu symptoms. Please, do your part. Get a flu shot. And I'm going to repeat one more time. I'm asking you. The choice is yours. I'm choosing kids. I'm choosing schools. I'm choosing jobs. I'm choosing Nevada families. Please wear a face covering, practice social distancing, wash your hands, avoid large public and private gatherings. And if you're sick, please stay home. Thank you very much, and I'd be happy to take some questions if anybody's got any.
We ask that you guys come up to this podium, and I think there's a button to turn the mic on. And if we can keep it to one question at a time, looks like we should be able to go through a few.
Hi, Governor. Good to see you.
How are you?
So under the CARES Act, the federal government has allocated Nevada $1.8 million, or 60 cents per resident, for vaccine distribution. With talks in Congress over a new relief package stalled, does Nevada DHSS have enough money to distribute a vaccine on its own?
As we are allocated vaccines, we will make sure that those vaccines can be distributed to our community. I'm hopeful that there'll be more CARES Act money coming after we get into another legislative round, I guess, in Washington, D.C. But we will make sure that those vaccines are distributed to Nevada residents.
Do you agree with Senator Harris that it'll only be safe to take a vaccine when Dr. Fauci says rather than when the White House says?
Well, I'm relying upon the FDA, the CDC, the medical experts and scientific experts. I am not relying on politicians that say it's safe, whoever they might be. I'm going to rely on our elected or our health professionals, our scientists, our doctors to determine what's safe for our residents, our people.
Thanks.
Thanks, Sam. We'll go to the next question.
Governor,
Well,
you mentioned wanting to get the conventions to 50% capacity by the beginning of the year. What do the numbers need to look like for us to get to that point?
Well, I don't have set in stone numbers that they need to get to. I look at more as trends and our hospital system. It's extremely important. We've got an increase in cases, but thank goodness there's not been a significant increase in hospitalizations or a commensurate increase in hospitalizations as a result of that. That's my goal, 50% by January 1st, but we're not going to get there by flipping a coin. We're going to get there if everybody is willing to put in the hard work to get us there, which involves the protocols that I set in place earlier. If it's important to you that we get our kids back in school, if it's important to you that we get our conventions at 50%, wear a mask, practice social distancing. So I'm hopeful we'll be able to get there by January 1st.
We've been on an uptick in a lot of the trends, especially a lot of the metrics. If this continues through November and December, would you still be looking to put conventions at 50% capacity,
Well,
or would you hold off?
I've had discussions with our resort partners. They know that a lot of this is going to be dependent on data that we get coming in prior to that and data that we get at that time. I'm hopeful that we'll be on a downtrend by that time. I'm hopeful that there'll be a vaccine available at that time. I've got a lot of hopes, but reality is going to come at the end of December when we find out where we're really at. But understand, you've got to understand, a lot of these conventions plan months in advance. And, you know, I don't want to lose the whole first quarter and second quarter of next year. Nobody does it better than Nevada does. And I'm confident that the resorts I've seen the protocols that they're putting in place in order to handle these conventions, these meetings, and I'm confident that they can get people here safely. I don't want to get people here and get them sick. You know, it's only going to work if we can get them here safely on our airlines, if we can get them into these properties and take care of them once they're there. And I'm confident that we have a protocol in place, and hopefully our numbers will allow us to proceed with that.
If we're not on a downward trend, will you hold off on that?
Well, I don't want to play the if game. I'm confident that we're going to be in a downward trend because I believe in the people of the state of Nevada. I believe that they want to open these conventions. You know, I believe that they want their kids to go back to school in Clark County, in the classroom. I believe that that's what they want. I believe that grandparents want to see their grandkids. I firmly believe that the vast majority of our residents of Nevadans want that to happen. And if they practice the protocols that we have in place, I'm confident we'll get there.
Thanks, Colton. Let's go to the next question, and let's try to keep it to one question at a time, please.
Governor, you advised Nevadans to avoid public and private gatherings, large public and private gatherings. In counties where gatherings of up to 250 people are allowed, is it safe to go?
Is the question, is it safe to go to a gathering with 250 people?
Yeah.
Yeah, I would prefer that the gathering be outdoors. I would prefer that, obviously, if you have the gathering, you still have to practice social distancing. You still have to wear a mask. You still have to do the protocols that are in place. But 250, and hopefully it's not for an extended period of time.
Thanks, Sam. We'll go to the next question.
Governor, you have 3 businesses in northern Nevada that are being fined for having larger than approved events without getting permission to do so, and you have several political rallies that are going that are larger, and you're depending upon Nevadans to do the right thing. Is some type of stricter enforcement going to be required eventually, because you've got businesses and you've got even individuals that don't care about the requirements and the restrictions and what you're looking for?
And I'm really glad you asked that question. It's unfortunate that we have a small minority of individuals that don't care, that are going to have these events and going to have them without protocols, without social distancing, without masks, and they are going to impact innocent people, and they will be infected as a result of someone's poor behavior. We do have, OSHA has fined some operations who have chose to knowingly not comply with our protocols that we have in place. You know as well as I do, we've got several coming in the next week with candidates coming, surrogates coming. There's a lot of rallies coming with 8 days left to go. That's great. I want everyone to participate in this election, whoever you support. It's not about who you support, but it's about supporting Nevadans. It's about supporting the health of the people that live in the state of Nevada. And if you're coming to Nevada as a guest, follow our protocols. 250 people means 250 people. It doesn't mean 2,000 people. It doesn't mean that you think this event is exempt from being a super spreading event, because it's not. You're coming here as a guest, you're welcome. We enjoy having you here. But when you're here, follow our rules.
Can I ask one more question?
Sure, go ahead.
Utah is to the east of us and is at 100% maximum. You said that some states are transporting patients outside of states to get the help they need. Is anybody sending any other states sending their patients here to Nevada to get treatment?
Currently, the only ones that we have are border state, ones where we have some on the border of Arizona, some in California, where it's the nearest hospital. We don't have any plan in place right now for any states to send patients as a matter of course. But I know I talked to these governors. A lot of them are really struggling right now. Governor Herbert is struggling. Governor Grisham. It's difficult when the hospitals. That's why it's so important that everyone does their part and we keep this capacity available in the hospitals. These frontline workers, these medical workers, I'm telling you folks, are doing an amazing job. They are saving lives, and we need to do our small part in order to help them continue to save those lives.
Thank you, Governor.
Thank you.
Thanks. We'll do one more from Colton and one more from Sam. And don't forget, we have Ms. McDaniel and Ms. Bennett here to talk the vaccine planning as well.
So on the vaccine, both of you mentioned that there is some hesitation from the public about getting a vaccine once it becomes available. Is the state planning on any kind of campaign or any kind of, basically some sort of a campaign to inform or persuade the public to get it once it is available?
Yes, we will be working with partners across the state, including our statewide immunization coalition, Immunize Nevada, to get messaging out when a safe and effective vaccine is available.
And we'll do the last question from Sam before we wrap up.
My question's for Shannon. So one of the questions that the National Governors Association had for the CDC was about ultra-cold storage, which you mentioned, and a potential dry ice shortage. Is there fear or worry about that in Nevada? What's our current capacity with dry ice?
Thank you for the question. It's a good one. I feel like we talk a lot about ultra-cold storage these days. So we do have a plan in place. We have identified ultra-cold freezers in 3 locations across the state, and we'll be able to redistribute vaccine from those ultra-cold freezers in quantities that will fit rural Nevada, because that's been one of the big logistical questions in dealing with this entire vaccine distribution planning. So there is a plan in place.
Why is rural Nevada more difficult?
Because there's a minimum order of 975 doses for that particular vaccine. So rural Nevada is concerning just because there's smaller numbers out there. So less concerned with Las Vegas and Reno for that piece.
Thank you.
Thank you. We're good.
Great, thank
Thank
you,
you,
everyone.
everybody, for coming. We appreciate it. And again, please, please, everybody, choose our kids, choose our families, choose our jobs. Wear a mask and social distance. Thank you.